Hello, everybody, and welcome. And welcome to Men's Health Connected on day 3 of Men's Health Week 2023, where the theme for the week in Australia is healthy habits. To celebrate that theme, the Australian Men's Health Forum is running a series of 5 lunchtime webinars on healthy habits called Eat, Sleep, Move, Connect, and Drink, which is the topic of today's talk. My name's Tynan and I work with Roses in the Ocean, and I'm here today representing Australian Men's Health Forum. And I'd like to start today by recognising the history and culture and wisdom of the Aboriginal Torres Strait Islander peoples. And I'd like to acknowledge the traditional owners of the lands upon which we meet today. I'm on Gimoy Wallabara land up in North Queensland. And I'd like to acknowledge the land that we're all on today and just recognise the deep and continuing connections with the land, water, and pay respects to the elders past, present, and emerging for the lands that we meet on today. In today's session, we are going to be talking about alcohol and men's health, and we're going to learn more about the benefits of cutting back on alcohol, an amazing topic from Katerina Georgi, the CEO of FARE, the Foundation for Alcohol Research and Education. Katerina is passionate about working with local communities, governments, researchers, and health professionals to develop evidence-informed policy, enable people-powered advocacy, and deliver health promotion programs. Katerina has an honours degree in public health and is a graduate of the Australian Institute of Company Directors, and in 2015 was a finalist for ACT Young Woman of the Year Awards. Katerina, it's a pleasure to have you joining us today, and thanks for being here. I'll hand over to you.
Thank you so much, Tynan, and thank you for the introduction. I too would like to acknowledge the traditional owners of the lands that we're meeting on today, and I'm joining from the very cold but sunny Ngunnawal and Ngambri country. So it's always awkward when a bio is read when you're standing there on Zoom and you're listening to it. But my name's Kat and I'm part of the team at FARE. And I'm really looking forward to talking to you about alcohol today. So I'm just going to share my screen because I've just got some slides. So just give me one quick second and we'll get the technology to work here.
And that's perfect. We can see your screen fine.
Excellent. Thanks, Tynan. So I'm going to talk to you about alcohol. Now, alcohol is something that is absolutely everywhere in Australia, and I'm going to chat to you about the various harms from alcoholic products and ways that people can cut back and the benefits of cutting back and stopping drinking as well. So just really briefly, firstly, about FARE. So FARE is the Foundation for Alcohol Research and Education. And we have 3 key areas of work. So one is that we're really keen for decision makers, so people in government, to implement policies and programs that are informed by people's experience. We want to make sure that people's voices are heard in this as well. There aren't very many people in Australia who don't have a negative story about the impacts of alcohol on them. And it's really important that that's communicated to decision makers so that we can make sure that we have the right systems in place to help to prevent these harms. And the other thing is that we have health promotion programs. So we provide information for people, and I'm going to be sharing a bit of that with you today so that if you want to find out more, if you want to understand the facts about alcohol, the risks, the benefits of cutting back, you can jump on our website and find out all that information. Really briefly to start, in Australia, a person dies every 90 minutes because of alcohol, and they're hospitalised every 3.5 minutes. So it really does have a significant negative impact on this country. And 1 in 10 Australians meet the criteria for alcohol use disorder. So this is fairly massive. And actually, the interesting thing about alcoholic products is that it seems as though we accept a higher level of harm when it comes to alcohol. These types of harms, if they existed in many other areas, there would be an absolute riot on the streets and people would be demanding action. But this is the sort of thing that happens all the time. It's the sort of thing that our hospitals see. And I think the thing to acknowledge is that alcohol is absolutely everywhere. So it can be really difficult for people to cut back and stop drinking. Every phone is now a bottle shop. On every corner, there is a bottle shop. Advertising is everywhere. People are targeted in lots of different ways. And a lot of the marketing from alcohol is dark marketing as well, which means that it's hyper targeted to individuals. So every ad has 1,000 different versions, and data is collected on people in lots of different ways so that they can be micro-targeted to. And that's really problematic when it comes to an addictive product like alcohol. And just to give you an example of that, so this is the feed of Johnny, who's 17. Johnny collected ads from alcohol, gambling, and unhealthy food companies over the course of a month. So Johnny's not meant to be marketed to at all. Facebook says that there's no way that they're advertising to him because he's under 18. And he collected 57 ads over that month and sent them in. So it starts really young, it starts really early, and companies really do target people with this sort of marketing. And the reason I provide that context is because it's really important to acknowledge that it is everywhere and it is really tough. So we need to address this kind of system change if we're going to overcome this. So 36% of alcohol in Australia is sold to 5% of people, which means that these really are companies of addiction. They're selling lots of alcohol to a small number of people, and that is their business model. For that 5% of people, alcohol companies are relying on them drinking about 8 standard drinks a day. And so that's fairly high risk alcohol use. And when it comes to this, men are more likely to drink at riskier levels than women, and people in rural and remote areas are as well. And men are also more likely to experience the various harms from alcohol. So they're more likely to die because of alcohol, more likely to experience liver disease as well. So what the government has done is that they've developed alcohol guidelines, and the alcohol guidelines are based upon a 1 in 100 risk. So what that means is that if people drink within the guidelines, their risk of dying from an alcohol-related condition is 1 in 100. And the guidelines say that people drink no more than 4 standard drinks on a day and no more than 10 standard drinks in a week. And that's the risk to reduce people's risk of cancer, to reduce the risk of other chronic diseases, to reduce the risk of the more than 200 diseases, injuries, and illnesses that are caused in some way by alcohol. So one of the things we do here at FAIR is to share people's stories of the impact that alcohol has had on their life. And I wanted to share this story because this is the story of Tyler. So Tyler talks about alcohol, and he talks about something that far too many people are familiar with, which is the fact that people are sometimes using alcohol as a way to cope. And we know that this happens even though alcohol actually contributes to anxiety and contributes to worsening mental health. So I'm going to share this video now.
My name is Tyler Brown, and it's been exactly 12 months since I've had my last drink. My teenage years were completely obsessed and immersed in the bodyboarding culture. Out of the water, what came with that was also a massive partying culture. You know, my early 20s was, work hard, play hard. When it was the weekend, it would be time to blow off steam, and we would reward ourselves by drinking excessively. So it went from like being a social thing, then it went from being a reward thing, then it went from being like a permission thing, and then it just went to like any little reason to be able to have a drink. I was always giving myself permission to drink because it wasn't causing any problems. Towards my 30s, that's when things started to spiral down, and I suppose the point when I realised that drinking had become a problem and that I needed to make a significant change was when I ended up in hospital. My self-esteem was at 0, my confidence was at 0, and my anxiety was 10 out of 10. I had to go wake up my parents, and I woke them up and I just said, I can't cope anymore. And it was the first time that the words came out of my mouth and that I realised that I wasn't coping. The only way I can just describe it was like this war was like raging inside of me. I was experiencing thoughts of self-harm. it was just became too much. It was a breaking point. Where's the problem in my life? Like, what's causing me the problem? And the one consistent thing that was there was alcohol. So I was like, I just have to change that. And I knew I couldn't just like cut back on drinking. I knew that that was not going to be an option because I just did not have that strength in me. So I knew I was going to have to stop drinking. I've learned so much about myself over the last 12 months. I've reconnected with the ocean, with surfing. I've started surfing more, like as much now as I probably was in my mid-teens. Yes, the triggers absolutely do come through sometimes, but they're followed up with equally strong thoughts that I've like intentionally drilled into myself that'll stop me from going back down that path.
So that's Tyler's story, and Tyler's story is one that's shared by many, many Australians across this country. So Tyler speaks a little bit about triggers here, and we'll chat about that when we talk about some strategies that people can employ to help to cut back. But I think the really important thing is that by sharing stories, it helps us to understand that, you know, we're not alone, that this is something that's experienced by lots of people. And talking about the negative impacts that alcohol has on people's lives is really important because it helps us to bust through stigma, and it helps us to make sure that people understand it's okay to say that, you know, things aren't quite right. It's okay to reach out for help. It's okay to access a range of services. And that's really important because the average time it takes for people to reach out for help with things like alcohol use disorder is more than 20 years. And what we want to do is we want to make sure that it's less than that, and we want to make sure that people are getting the help that they need. You know, the reason why this presentation started with that description of the environment, the fact that alcohol is everywhere, is to show that this isn't, because it's happening to so many people, it shows that there are lots of environmental factors that are contributing to this. And it's really important for us to acknowledge that and to acknowledge the role that these alcohol companies play in pushing these products on people, and that it's totally okay to say, look, I really do need help. So I'm going to talk to you now about alcohol and a range of harms. So alcohol is a cause of cancer. A lot of people aren't aware that alcohol is a group 1 carcinogen, which means that it's in the same category as tobacco and asbestos. And alcohol causes 7 different types of cancer, which you can see here on this screen. In Australia, alcohol is responsible for more than 5,000 new cancer cases each year. And the more that people drink, the more likely the risk is of getting cancer from alcohol. Alcohol in the short term also has a range of impacts. And one of those impacts that people are fairly familiar with is alcohol's impact on sleep. So alcohol, even in small quantities, can disrupt sleep. And that's because it increases the production of a stress hormone that increases heart rate and stimulates the body. And also alcohol is a diuretic. So it means that people get up more to visit the bathroom during the night. And we all know how important sleep is to both our mental health, our physical health. So one of the things that people talk about when they've cut back from alcohol, one of the most immediate things that people notice is how much their sleep changes and how much their sleep improves. Even from, you know, dropping back a couple of drinks or dropping from a couple of drinks to no drinks, for example. So here are some tips and tools for cutting back. And these are all available on our website for people who want to find out more information. So it's important to know that, as I've said a few times, it can be really hard to cut back, but there are some strategies that can really help. So one of the things is to know the guidelines. So to know that if you are going to drink alcohol, that the National Health and Medical Research Council recommends no more than 4 standard drinks in one day and no more than 10 standard drinks across a week. So a couple of things that people can do is to count drinks and to be aware of those guidelines, to try and have some alcohol-free days in a week, to try and have other alternatives to drink, to understand the triggers to drinking. So understanding if at the end of a day, that's the way that people are saying, I'm going to end my day with a drink, and then trying to identify those triggers and replace those with other things. So saying, instead of ending my day with a drink, I'm going to go for a walk, or I'm going to go meet a friend, or I'm going to do something else. So the other thing is to create different routines where drinks have become normalized. So if it's at the end of the week, or if it's at particular points in time, and that comes with replacing that routine with another routine. The other thing is that sometimes people identify in their lives that they have someone that's close to them who might be drinking in ways that are causing themselves or others harm. And so we've just got a bit of a guide and some tips for someone to talk to someone that you love about their alcohol use. So the first thing is to find a moment when people are calm, when they're sober, and also to make sure that you're safe as well when you're having this conversation. The other thing is to ask open-ended questions and use positive language. Speak about how the concern is around the person's health, the person's well-being, and you're just really keen to support them. And also to be aware of the various support services that are available so that they can access support when they need it. Now, I've mentioned a few times that there are a range of support services available. The first thing to acknowledge is that if people are drinking at really high risk levels, then stopping drinking altogether without the support of a health professional can be dangerous to your health. So it's really important that you chat to a GP, or you chat to another alcohol and other drug support person, or the National Alcohol and Other Drug Hotline if you are drinking at high risk levels, because stopping altogether without support and without detox can be harmful to someone's health. There are a range of different services, both online, face-to-face, and on the phone. So people can get help through support groups like Alcoholics Anonymous. You can call the National Alcohol and Other Drug Hotline, which is a 24-hour number. And then there are online support groups as well, like Hello Sunday Morning or Sober in the Country, that people can reach out to. And there's a full list of these available on the website. Also, there's a list of supports available for mental health support or family violence support, so we understand the intersection between alcohol and these other harms as well. So very happy to answer any questions that people might have about alcohol, about cutting back, about the various harms from alcohol. And if you need any other information at all, or if you want to reach out, then the contact details that we have are on the screen there. But yes, very happy to answer any questions now.
Thanks, Katarina. The first question that we've got is from Andrew, who also put a side note to say that he is a collector of single malt whiskey, but they're unopened bottles. So Andrew's question is, he's got three questions. Is the object of FARE to prevent drinking, including responsible consumption?
That's an excellent question. So FARE has a vision to prevent the harm from alcohol. And that's why we communicate the guidelines, and we communicate the need to, if you're there to reduce your risk of harm, then drinking within the guidelines is really important. So our aim is to prevent harm from alcohol.
Great. And that sort of leads into his second question around the guidelines. His question is, what was the shift behind the previous drinking advice of 3 in the first hour for men and 2 for women, to 2 drinks in the first hour for everyone, then 1 per hour after that?
That's an excellent question from Andrew, because this is a really common misconception. So the most well-known and understood campaigns around alcohol in this country are around drinking and driving. And so the message that used to be provided around drinking and driving was that 3 and then 1 every hour after, and 2 and then 1 every hour after. Now that message has been moved away from completely in relation to drinking and driving, because different people's bodies process alcohol in different ways. And so, for example, I'm about 50 kilos and 5 foot nothing. And so it takes about 2 hours for a standard drink of alcohol to be processed by me and my body. And so that's actually not a guidelines message. That was a message around being over the legal limit for alcohol use. And these are guidelines. So this guideline is based upon all of the evidence we have around the risk of alcohol harms and its contribution to things like cancer, other chronic diseases, injuries, and death. And this information is about how people reduce their risk of those diseases.
Thanks. I wanted to come to something you highlighted before at the start of your presentation around these devices and how we have access to alcohol everywhere. And I know I've been at people's houses before and it's like, oh, I need wine. I'll go to the shop. Oh, hang on, I'll have one here in 10 minutes. What's happening in the national level? Like when you talk about the 3 objectives that you spoke about before around like the advocacy, the health promotion side of things, what's happening in that actual focus on the use of alcohol being easily delivered? How are they monitoring that, or are they doing that?
Another excellent question. So alcohol delivery has expanded exponentially, and COVID really accelerated that expansion. And alcohol retailers, so really large alcohol retailers and companies, know that particularly when alcohol is delivered rapidly into the home, like you just described then, Tynan, people are more likely to drink at high risk levels. So some data that we have shows that when alcohol is sold into the home in under 2 hours, people are more likely, 40% of people report drinking 11 or more standard drinks. Now, the laws haven't kept pace with that change. So a lot of the laws in relation to alcohol relate to pubs, clubs and bars and bottle shops rather than the delivery of alcohol. And so at the moment, we're working with governments across the country to try and introduce some harm minimisation measures, because particularly tied in with people who are trying to cut back, one of the things that we used to say was, try and control the amount of alcohol that's in your house. So now this having your phone, every phone being a bottle shop, means that it's really hard for people to put those limits in place. And the other thing is that alcohol companies can use data on people's alcohol use to target them more with marketing. And so in the same way that if you jump online and you buy a book, you then see lots of book ads, that happens with alcohol as well. And so we're trying to work with governments to change privacy laws so that information about whether people access health services and the amount of alcohol people are buying isn't used to market to them. There's a lot of work to be done there. And we're seeing an increase at the moment in alcohol-induced deaths, which is really sad and really devastating. And we need to make sure that companies aren't using technology to drive more harm.
Yeah, it's really alarming when you look at it from the responsible service of alcohol perspective as well. Like someone behind a bar has had some training versus the Uber driver who's just out to get money, and like that expectation on them to sort of say, like I've had friends say that to me, like the Uber driver will sometimes say, "Oh, are you drunk?" No. Like, but is that going to be something regulated as well? Like, is that in the mix to say, okay, how do we make an Uber driver a responsible server?
Yeah, the other thing to think about is the safety of the people who are delivering alcohol, because these people are in their workplace when they're delivering alcohol as well, and the responsibility of that workplace to keep them safe. So a couple of the things that we've recommended is that alcohol isn't delivered really late into the night into people's homes, and that reduces the likelihood that then people are intoxicated, and that also harms are more likely to happen later in the night. And the second thing is that we'd like to see a 2-hour safety pause between when alcohol is ordered and when it's delivered, so that if someone is intoxicated at the point of delivery, there's that time then which can help to address that. Because the truth is, Tynan, even if we have responsible service of alcohol training, when that person is in that circumstance, it can be really unsafe for them. It can be unsafe for people to refuse service in lots of different circumstances. And so we really have to try and reduce the amount of alcohol that's going out at the times when it's higher risk and in ways that we know are higher risk. Such
important work and such a big job. Got a question from John Millam. Do we track the deaths of despair measure, and do we know how that impacts on community?
Yeah, look, John, we can always have better data. I think is a clear message. And you hear that across alcohol use, other drug use, around mental health as well. So what we know is that COVID has impacted on people in lots of different ways. We're a community that went through fairly extensive bushfires and the impacts of smoke on communities. Then we went into COVID, and that collective trauma that people have experienced has an impact on them. And one of those impacts is that we're seeing people drink at higher risk levels to cope, for example, with the different stresses that are happening in people's lives. And so what we're seeing in relation to data is we're seeing alcohol-induced deaths increase. We're certainly hearing a lot more about alcohol's impact on mental health. And so we need to better understand that, but also we need to not accept that. As I said in my presentation, there's this general acceptance that, you know, we accept a really high level of harms when it comes to alcohol. A person dying every 90 minutes, if that was happening on our roads, if that was happening from anything else, there'd be an uproar and we'd be making changes to that. So we need to acknowledge that it's not okay. It's too high a toll. And for every person that is directly impacted by alcohol, they have a family, they have a community who's negatively impacted as well. And we recently released some research alongside the Centre for Alcohol Policy Research that showed that 10 million Australians are indirectly impacted by someone else's alcohol use in a range of different ways. And that's just not okay. We need to make sure we're doing more to prevent that.
Alarming statistics. You touched a little bit on stigma before, and I'm just wondering, what role does stigma, or how does stigma play out for men who potentially want to get some help for the drinking problems, or like they've probably got that awareness, hey, maybe I'm drinking too much, but what role does stigma play in that when we look at it from also, I guess, the role that masculinity plays?
Yeah, look, I think that stigma is really interesting, and it's interesting in this space because alcohol companies spend billions of dollars creating an individual responsibility frame. So what they do is they say there are responsible drinkers, and that's the vast majority of people, and then there's this group of people, and they're the bad apples, and that's where we need to focus it. They spend so much time focusing on that. They use drink responsibly taglines. They promote that to governments. They really clearly keep pushing that narrative. And it takes the responsibility away from these companies who are pushing their sales most to people who are most vulnerable. So I think the first thing that we have is we need to stop talking about that responsibility frame. We need to stop talking about individual responsibility, and we need to talk about corporate responsibility. You know, where is the responsibility of these companies to make sure that they're not selling products in ways that cause more harm? If we flip this and we flip it on its head, flip the way that alcohol has been spoken about, then we can address this stigma, and we need to address it if people are going to seek help. Because people are reluctant to seek help because there is this broader narrative around alcohol that, you know, companies spend millions of dollars pushing out, and they're reluctant to seek help just because of the general things that we know around men and help-seeking behaviours, like that reluctance to really seek help unless there's something really wrong. And so we need to talk about alcohol differently. We need to talk about the fact that these companies are pushing a product in a particular way on people who are at their most vulnerable. And we need to flip it on its head so that when people do identify that they have a problem and that they do need help, that they feel like they can do that. And that's a role that we can all play, Tynan.
Absolutely. And is that sort of the angle of the lived experience aspect? Like, I love that lived experience is getting utilised for the power of storytelling across many, many fields now. And how did that fit in, and how did that come in to be play for FAIR?
Yeah, so for us, Tynan, you know, FAIR is an engine room for the community who is negatively impacted by alcohol, and that's far too many Australians. And so if we can play a role in amplifying people's voices, in understanding the way that people experience alcohol harm and the types of solutions that people want to see, if we can play a role in communicating that, in connecting people with decision makers, then that's absolutely the role we should be playing. And that's where stories like Tyler are so important and so powerful, because people aren't alone in this. This is something that so many Australians experience. And by sharing that, by showing people that, it helps us to address stigma, but also to show the many different negative ways that alcohol impacts on people's lives.
Great stuff. Now, when you spoke about the health promotion aspect for like for your work that you do, I was sort of thinking in terms of the biggest challenges that the male population face around alcohol consumption or addiction. What are the variations in terms of the age groups and the demographics of the population? And sorry if that's a massive question.
No, it's totally fine. So as I said, men are more likely to drink at high risk levels, and then they're therefore more likely to experience a lot of those direct harms. Those harms are more felt among men who are in their 40s and 50s. That's where we see the majority of high-risk drinking and harm then, and that's following people into later years now as well. So that's where we're seeing that. And unfortunately, there are also groups of people who are least likely to reach out for support and to reach out for help as well.
And what about for like the younger age group, like in terms of them engaging in help seeking? Is that something that we're looking at as well, like to start that at the early ages, or what's too early to start promoting healthy drinking habits?
Yeah, look, I think that whether intentionally or unintentionally, kids are gathering information about alcohol from a really young age. Like there are studies that show that kids in daycare can talk about the types of drinks that their parents have. So there are kids in daycare who talk about daddy's beer glass or mummy's wine glass. They're noticing, they're picking this up. And what they're also picking up is the ways in which alcohol are used. So we often talk about how it's really important that adults aren't role modeling around kids things like, oh, I've had such a tough day, I need to have a drink. Because then what that child does is they associate stress relief with alcohol use. And so the first thing to point out is that because alcohol is everywhere, kids are noticing it. They're noticing the branding, they're noticing, and anyone who hangs out with a small child knows how clever they are and how much they pick up these things. With advertising as well, as adults, we usually switch off from advertising and kids' ears prick up because there's music and there are different sounds and they can't distinguish those ads from the television programming. So they're really noticing that as well. And they're seeing the branding as well on sporting teams. They're seeing that association between alcohol and sporting success. So it's really important that because we know it's there, that conversations are being had around this from a really early age. For young people, we're seeing a decrease in risk-taking behaviours across the board in general. So what we're seeing is that kids are less likely to drink at high risk levels than they were 20 years ago, less likely to drink underage as well. And we're seeing that with other behaviours, with, tobacco, with even things like unsafe sex behaviours. So just a general reduction in risk taking. But what we're also seeing is people who were drinking at high risk levels at a time when we were talking a lot about binge drinking among young people 20 years ago, they're having that high risk drinking follow them into later lives. So those people have gone from 20 to 40 and a lot of them are still drinking at high risk levels. And they're also now parents as well. So they're thinking that the way that they drank was a particular way, so their kids are going to drink in a particular way, and they're then providing information that isn't consistent with the way that their kids see the world. So there's a little bit there to unpack. But I think that, if we look at health promotion really broadly, kids notice, they see the things, it is everywhere. So the earlier we can have conversations about it, the better.
Great. And on the health benefits aspect, when you mentioned some pretty alarming statistics around cancer, sleep deprivation, and stuff that's associated with alcohol, when people make changes in their alcohol consumption or they reduce it, how quickly do you see the benefits, and what level does that actually, counteract the negative impact that alcohol consumption has had on their body?
Yeah, and so we're seeing more and more evidence, as we did with tobacco, which shows that the time that you spend not drinking then means that your body over time recovers in lots of different ways. And so it prevents you from having those long-term and chronic conditions that we were talking about earlier on. In relation to immediate impacts, people talk about how once they've stopped drinking, that their sleep is better within a few days. So they're sleeping better, they're feeling more well rested. People speak about within a few days as well feeling less anxious. And so that feeling of anxiety, that feeling of worry, that feeling of stress that they had, or that fog that they had, has been lifted, and they didn't realise how even a drink or two contributed to that. And also having more energy. So people talk about how they have so much more energy. And that, is something, Tynan, that we all want, because we could all do with a lot more energy after all of the things that we've been going through and all of the things that we continue to go through.
Absolutely. And great outcomes for people just making some positive changes in their life. We've got another question that's come in from Patrick, and it's got a bit of a pre-context. So great to see the discussion around masculinities and the flip of the model of responsibilities. It's interesting to see how the legal drugs, such as alcohol, where industry is visible and active, individual responsibility is pushed, whereas for illegal ones, we blame the suppliers. Are there stats or statistics on the change in perception of masculinity and its impact on alcohol consumption?
Oh, that's really interesting. Look, we certainly know that alcohol companies use masculinity in their promotion of products. And you see that quite a bit. At the moment, the State of Origin is on TV. We've got the second game happening next week. And so for those of you in Queensland and New South Wales, you'll be well aware of that. For those of you in other states, you might be saying, well, it's not my code. But what happens is, to coincide with those sporting events, whole beer brands create whole products that are based around it. So there are 2 beer products that change their branding to reflect the branding of the teams. They talk a lot more about winning in that way and celebrating in a particular way. We know from research that around that time we see higher risk drinking and then the negative impacts of that. So masculinity is used a lot by alcohol companies to market. It's used in probably less obvious ways than it has in the past. Like, I remember a promotion about a decade ago where a beer company was saying that you could have your mates be on a deserted island, and the way they spoke about women being excluded from this island was absolutely appalling. But it's still there, and they still use that quite a bit. So I think it's still very present. And that's because alcohol companies are really focused on increasing drinking among people who are the most high-risk drinkers, and the people who are the most high-risk drinkers are men. So they tap into all of the notions of self, of community, of the way that men connect and socialise to try and drive and increase that alcohol use, which is really concerning and problematic.
Definitely the psychological aspect coming into bad play in the world that happens all around. Really intrigued. Since you've been the CEO for FARE, what's been the biggest lesson that you've learnt in the space about alcohol in general, whether or not it's for male populations or just in general? What's been the biggest thing you've learnt?
Oh, that's it. So I was at FARE about 15 years ago and then came back about 3 years ago. And I think that there have been some interesting changes from then to now that I observe. And one of those is how successful alcohol companies have been in promoting this as a really normal part of life and how much harm that causes. The other thing is just the extent to which these companies will talk about how, there's the biggest alcohol retailer in the country talks about how they want to be the Netflix of alcohol. They want to know so much about someone that they can micro-target to them at particular moments to really drive their drinking up. So I think that the biggest lesson for me in being here is how aggressive, how manipulative, how exploitative these companies are, and how little is known about that, how little we talk about that, because we just continue to talk in the frame that they've created, which is the frame around individual responsibility. And I think that's something that we should know, because I think as a community, you know, we don't want people who are doing it tough to be treated in these ways. We saw during COVID, Tynan, that ads were changed to focus towards people who were doing it tough, telling them that the way to cope, the way to get through COVID was to drink alcohol. And they're the types of behaviours that are employed by these companies. And that's something that, you know, it's not okay and it shouldn't be happening. There should be regulation around these things, and it just doesn't exist.
Yeah, it's alarming to hear those sort of stories that they were able to change and manipulate that. We just had a question from John Millen come in. Numbers and the outcomes were compelling. However, men have often made a choice to ignore the message of self-harm. Do we have a plan to combat the tendency in our marketing of the harm drinking does? Great question.
Yeah, I think there's two components of this. So one component of it is we just have to think about the way that we use the word choice. So if there are lots of cycling paths, if, you know, you live in Cairns and the weather is great, you're more likely to be outside, you're more likely to run, you're more likely to cycle. So our environment has a direct impact on the behaviours that we engage in. And so with alcohol, if it's readily available, if it's heavily promoted, if it's cheap, if these companies are able to target people in the particular ways that they are, then you have to start thinking about how much choice is in that when it comes to those things. So that has to be controlled. And that has to be common sense measures and checks and balances need to be in place to make sure that people aren't just bombarded. You know, speaking about every phone being a bottle shop, how do people employ activities like not having alcohol in their house or trying to avoid things when ads keep popping up, when people who are saying, please don't promote to me, are still being promoted to? Like, what sort of choice do people have when those sorts of things are happening? On the other side as well, we need to be really thinking about the way that people receive health information. And there needs to be consistent and persistent messaging around this to people. So in Australia, despite the harm that alcohol causes, there has never been a campaign towards adults on alcohol. And so I think that that's really interesting, and I think that that's something that needs to be addressed. But that campaign, even if it's resourced really, really well, it won't counter the many, many millions of dollars that's spent on marketing by alcohol companies. So you have to reduce those really terrible behaviours by alcohol companies to take advantage of vulnerable people or people who are at the most vulnerable, whilst also increasing the amount that goes into understanding how people receive messages and doing really targeted campaigns towards people.
So much work to be done. It sort of leads me to my next question for you. So say it's 20, 30 years from now and you've left FAIR and you're enjoying a sunset somewhere. What would you like to be known for having achieved with your time here? Like, what would you like to see shift in Australia?
So I think that so in relation to the outcomes of it, it's such a big time, and you only ask the simple questions today, don't you? I think that I'd like to see the narrative completely flipped so that we can reduce stigma. And I'd like to see companies being held accountable for driving this harm, for putting more stores in area that are low socioeconomic status, for doing these types of things that we know are contributing to harm. If the narrative is flipped of one from individual responsibility to corporate responsibility, then we will see more people seeking help. We will see better checks and balances put in place, and we will see a healthier community and less alcohol harm. Until that's flipped, it will be really difficult to see these changes. So while people view this as an individual problem and people view this as a really, these practices by companies as just normal corporate behaviour that's okay, if that's the way this is viewed, then we're not going to see the sorts of shifts we need. So what I'd like to see is an environment where people do seek help and where there's less harm. And there's a bit of structural change that needs to happen to get there. But Tynan, I should point out that I am extremely optimistic because I speak to so many people who are really concerned about this. And there are more and more people who are really skeptical of the ways in which these companies are acquiring more and more profit from people who are doing it really tough.
Yeah, you're right. It was a big question. My final question for you is, what's been your proudest moment?
I think that my proudest moment here at FAIR is when I'm speaking to people who have experienced harm from alcohol. And when they say, I really feel like, FAIR has heard me and helped me to advocate for change and help to elevate my voice and my story, and that it's making a difference. That's what makes me really proud, because that's why we're here. We're here because we're part of the community that's experiencing these harms, and we're here to make sure that we're elevating community voices so that we can get change.
Great question. Look, I really want to thank you and honour you for your time today and coming on to share with us your wisdom and your insight, and really just acknowledge the amazing work that you're doing and the contribution you're having around the country in this space. Like, it's such an important topic, and in sort of preparing for this, I saw the work that you've been promoting as well around the pregnant pause and that work as well. It's so important to have that awareness and have that out there, but to go beyond that and create the structure that happens at the highest hierarchies of the country that really support it. So we have the environments and we have the services in place to really promote that. So I just really want to thank you and acknowledge you for all the work that you've been doing. And yeah, thank you. Have you got any final comments?
Thank you. And right back at you for all of the amazing work you do as well, Tynan. And I think the final comment is that, if we can all leave today talking about shifting the narrative on alcohol, and contributing to creating a really supportive environment to really bust through that stigma, then we can all play a role in creating change.
Amazing. Thank you so much. And thank you to everyone for joining in today. And thank you, Robin and Kim, for your support. Just a reminder, there are still 2 more sessions still to come up. On Thursday, we've got 10 facts about exercise at Men's Health. And Friday, we've got a session on nutrition and men's health. I've also just provided a link in the chat to provide some feedback. It'll probably take you around about a minute to complete that, but we really like to take on board the feedback and just get your insights into what else we can do in this space. So thank you everyone for logging in today, and hope you all have a wonderful rest of a Wednesday.